One more reason why breast cancer tends to happen in a woman's 60s during a time when hormone production is lower, but the majority of breast cancers are hormonally driven. So to recap, before a breast cancer diagnosis usually arrives, you've had 10 years that something's been brewing in the body. So it usually takes 10 years for something to develop. So what happened to the hormones 10 years before the 60s? And then number two is that while estradiol, the strongest estrogen, does usually go down, there's other types of estrogens. There's estrone, there's E2S, so it's just not as commonly tested, all the estrogens. Number three is that levels of progesterone tend to drop significantly before menopause. And so when you have low levels of progesterone, that can be an issue because progesterone balances out estrogen. The other reason was that when you age, estrogen doesn't go to zero. It's still getting produced in your fat cells and your skin cells. So you really need a test to show if just because you're in menopause doesn't mean your estrogen's zero. We see plenty of labs that women are estrogen dominant in menopause. But the one I forgot is a limitation in testing because tissue levels of estrogen are different than serum levels of estrogen. And so it's very difficult to get a biopsy of the tissue and see what your estrogen concentration is. But just because you have a level of estrogen in the body, in the serum, in the blood, doesn't mean it matches what's in the tissue. And you actually don't know the amount of estrogen in the tissue. Sometimes it can be a lot larger than what's in the serum. But that is just a limitation of testing. And a way to get around that is to measure more biomarkers. Usually something like prolactin or E2S can be helpful to really understand what's going on in the body.